Hey, welcome to Talking with Bart, where I interview different professionals and try to get you guys a bird's eye view to their insights. Today I have with me Dr. Rodriguez. She is a physical therapist. I'm going to be asking her a array of questions, and she's going to do her best to answer them. And can't wait to get started.
Hi, my name is Araceli.
Okay.
I have a doctorate in physical therapy. What would you like to know?
All right, so I do have a couple questions for you. I went on Facebook and I asked a couple of my listeners to send some questions, and a couple of them did send a couple questions, and I included them here. So the first one is, we're gonna get started now. When did you first decide to become a PT and why?
Probably made that decision in my teens, later teens, probably 18 or 19 years old. I had already finished my first year of college, and I actually did my first year. I had majored in computer business applications and business administration, which I decided I did not want to do that at all. I really wanted something in the medical field, but I didn't want the stress of being full-blown MD and the residency and the loans that came along with it. I wanted something with a flexible schedule that I wouldn't have to work nights, but still felt like I was making a difference.
Awesome.
So I went with physical therapy.
Nice. Has being a PT met your expectations?
Yes, pretty much what I expected. I've had flexible schedules. It depends on where you work. Of course, if you're working in the hospital, you'll still have to work holidays, but you don't have to work nights.
Okay, good. What do you like most about being a PT?
Basically, I feel like I'm making a difference and helping people in a different way. Taking a more conservative approach and helping people. Right now I work with geriatrics, so I'm helping the older population become independent or more independent so they can go back to their normal lives, or help them make decisions so they can reach their maximal functional level. But before that I worked with pediatrics, which is also very rewarding.
Awesome.
And outpatient.
Nice, good things. How about what's the thing that you like the least about your job, being a PT? So when I'm asking being a PT, I mean about what you do when it comes to your job, not the company or the administration or anything like that, just the PT work itself. What do you like the least about it?
I really don't have a problem with my job at all. I'd say the most tedious part is, of course, documenting everything, which is important. You have to document, so the person coming after you, or you see so many people, so you have to keep track of the progress and what you're doing. But like you said, there's other aspects of it. One being stuff, insurance companies, Medicare, having to document everything a specific way, which could take a little longer.
Okay, now describe a typical day as a PT.
I work in a skilled
nursing
facility, a short-term rehabilitation. So when I come in the mornings, I basically come in whatever time I feel comfortable. They issue a schedule out, and as long as you complete that schedule, you can come in pretty much anytime that works for you. So I like to be there before 8:30 in the morning. I pick up my schedule. I see all my patients in the morning just to let them know what time I'm going to see them, give them a time frame, and then I go from there.
Nice. Now, this question came up about 4 or 5 times, and if you guys need any help with the answer to this one, Please listen to Talking Money with Bart. But the following question is, are you satisfied with your income as a PT? Had 4 people actually that asked me that question.
I think it doesn't, based on the amount of money that you pay nowadays to graduate with your doctorate's degree, I don't think it averages out, or it takes a little longer for you to get that back. But for the most part, it's a decent living. Okay, good.
And it's funny because I think it was yesterday I did a podcast talking about no matter if you're making $1 million or $500, you should always have a budget. So if you're asking this question, I guess in my point of view, the answer is have a good budget and make sure you stick to your budget. And if you make $1 million and you still spend $1.5 million, you're still broke. So it's one of those things. Make sure that you manage your money correctly. Now this question. It's I think another doctor, which I am going to interview sometime next week, was the one to send me this question. Dr. Rafa Bones. I spoke to him and he told me to ask you this question, which is whether you see PT in the next 10 years and what can you do to change its outcome?
I think PT is definitely becoming more popular. I think a lot of people are becoming more aware of conservative approaches and kind of going back to changing their lifestyle, eating healthy. Not being a physical therapist is not just physically rehabilitating someone, but also mentally. It takes a lot of education to do that, and there's also a lot of technology being introduced into the field, and it depends on the field that you're working in. For example, if you're working with athletes, there's a lot of fun tools and technology to help identify the issues and help them see what's going on so they can self-correct. Provide, biofeedback is basically what we call it. But I think it's gonna keep progressing. I think the field is definitely growing, and hopefully it continues to do so.
Nice. Now, what advice would you give a young student that wants to go into the PT field? What would you tell her?
I would tell them basically that I would tell anyone else looking into any other career, just go ahead and volunteer your time so you can observe, and not just one day, but a couple days observing, and not just one particular field, pediatrics, or geriatrics, just different areas of it. You might be surprised. There's a lot of people that say they don't like working with kids, and then they do one day, a couple of days with peds, and they love it. But definitely take the time to volunteer and observe and make sure that this is definitely what you want to do, because it is an investment. You're investing time, not just the time, the money, the tuition to complete the programs, and it is about 7.5 years, your bachelor's, and then 3.5 to 4 years of education. So take your time, observe, ask questions, make sure this is really what you want to do, and then go from there. Decide what school, what program best fits you.
Nice. And with that said, I also want to throw in that follow your passion. Just pick something that you're truly passionate for, whether it's PT or anything out there. Just make sure you fall in love with what you're doing. There's nothing worse than a person that ends up graduating once they invest their time and their money in a field, and then they don't want to do that field anymore. It's depressing. Final question, and here we go. Do you have any final thought or advice for anyone out there, not just a student, but a patient that wants to go see a physical therapist but don't know how to start that conversation? That they're having back pains, but they don't know if should they see a physical therapist or a chiropractor they having knee pains, whatever the case is, what will you say as a final thought to the patient that's never seen a physical therapist, and to anyone out there that's just listening to our show?
First off, I definitely want people to understand that there is a big difference between massage therapists and physical therapists. We do incorporate what we call soft tissue mobilization, but we are not massage therapists. And I realize that's a misconception, or some people come in with the expectations that they're just gonna come in for therapeutic massages and that's it. The physical therapist is there as a guide, a teacher. Like I mentioned before, we educate so you can understand your body, understand the condition, understand how to manage it, how to take care of it. But you do have to put in some work. We will provide some advice, some a little more knowledgeable when it comes to nutrition and might recommend a certain diet to help. For example, sugar is known to worsen inflammation. So, we would say that's one of the things that you probably want to stay away from, or if you have a lot of swelling, stay away from a lot of sodium, things like that. But overall, we will guide you, but at the same time, you need to follow the instructions provided, whatever diet or whatever pain management routine, whatever therapeutic exercises, things that we ask you to do in between. Because most of the time when people go for an outpatient service, they're only going to the office 2 to 3 times a week. So what you do in between that is important, is very important, and will help you progress that much faster. At the same time, if you feel that it's not helping, or at any time you feel that what you're doing is making your condition worse, you also have to let your therapist know so they can modify, or sometimes it's not appropriate. Sometimes you have to go back to your doctor and maybe get some images done. Most of the doctors will send you for therapy first as a conservative approach, and if things don't change, then they'll bring you back in and they might recommend an x-ray or an MRI to further figure out what's going on. So the communication is definitely important, and the compliance with the instructions and the exercises is also a major deal.
Perfect. I want to thank you for being a part of the first Let's Talk with Bart. I want to also thank the listeners for being a part of it. And as promised, I'm going to try to do at least one of these a week. I want to encourage you guys to listen to the Movement Network. You can get your daily dose of boxing, you get your weekly dose of motivation, you get your weekly dose of finance / we discuss about money, the stock market, cryptocurrencies, and now I'm introducing Let's Talk with Bart, where I try to last at the minimum of 5 minutes talking with someone that has a profession and ask them the most important questions. Thank you guys for listening. Again, Dr. Rodriguez, thank you for being a part of this. And I'll catch you guys in the next one.